Abusiafo na mo nyina kwaba e de mo ba my health checks with Dr Bobson Ateko e Lily MTV so. Abusiafo enen so yasane abetena yadwam na yade bi wo ho a ne ka no uhunu ne nte afa ho ka nyina me da omo ase omo nkrabata na tu atese obi koma probi a onom wo ho ukọ dome onom wo ho kwabenya omo wo ho pokuase ene nkrabata na hodo pii onom wo ho bomode ne pin ben omo na omo so ensiesio ema wo ho enyefe media ne Maame me na dwumadie me di ho chiame na me se Afro Sunset Lily M so de ba akopani nyina aye me ankasa enne Dr Asanje Nadwa Dr Bobson Ateko ono ne me doctor watu ne ho ama se obeboa no ne me aka abomu ne aboa ma apomuden eti brane na gina ho pintin na nyina yetimi nyina che na nyinche de eye doctor ena so me mo akwa aba doctor awon fere de sin da o doc why kama brante kwa why kama pa ai da se watu ho ama se ode ho ebebo afode na ne wasua no wabekire ne nyina yenso yesua bi me da se pa doc emne ne ebeka ho asem aye pese wo ma ye nchiremu eye deep vein thrombosis ebi atwa ne tiawa aka no DVT deep vein thrombosis me dey say yade we bi na make menti bi kurada wada wo ma deep vein thrombosis ene yade be ne a
okay see me da say asama me da say bi say o ma me akonya
yes doctor
nti you can't deep vein thrombosis a broad condition I refer to VTE venous thromboembolism
venous thromboembolism
under VTE no and obenya PE and DVT PE near pulmonary embolism and DVT near deep vein thrombosis na you can say but before I say me try to akra no PE no the life threatening and a severe or the complication of DVT no so DVT can progress to a pulmonary embolism and pulmonary embolism is a medical emergency it's very severe, life threatening, can easily kill you most of the sudden cause of death usually due to pulmonary embolism. You understand? So this is very, very important. What I was about to talk about today is also very important because the pulmonary embolism can be very fatal. So in the deep vein thrombosis blood vessels and I say intini and now your body anymore. It will be on my superficial and I say a bang skin no kakra and it will be a deep within the muscles. But what I say, area affected veins are deep within our muscles, no. But what I say, or deep within our tissues, no. But what I say, and they find deep vein thrombosis. But say, I will say, me share the friend with thrombosis, Nancy, because deep vein, they say, bro, veins that are deep within the muscles. Thrombosis, now I say, you can't thrombosis, I just say, the cracker say a plug, and I say, I'm going to say, BBR, it's me see or blood vessel, no quine. Nti bibia to me FFP or blood vessels nim na asi ne kwan and a friend thrombosis nti thrombosis ne betima ba say it comes out as a result of a clot. See some part of blood dey betimi clot in some situation the clot need to me blockade some parts of your blood vessels no nti say ejina baby ba ko a and a friend thrombus but they are enenam no the one traveling and a friend emboli nti na e pulmonary embolism and e thrombosis. So if the disease is due to clot, no, and I say plug na a stable, ejina baby bakuna, and a friend thrombosis. If the disease is due to the one that is moving, and a friend emboli, the back was deep vein thrombosis in your say clots of blood are clotted in your the veins that are deep within your muscles, no. Now it prevents blood flow to the lower extremities. No. Most of the time it affects the lower extremities, no, or lower the unine bra form, no. So there are certain major veins if they get blocked that usually that leads to the deep vein thrombosis, no. Usually veins near your lower legs, no. The popliteal veins near other veins there walk on, no. And no when those are blocked, so usually DVT usually affects the lower extremities. But I can have DVT to of some of the upper extremities. I blockade your femoral veins, no. So that can also there was is more dangerous, but it's not so common.
Okay.
The common DVT affect the lower limb, but there are through now affecting the femoral veins of our thighs. No, and they are more dangerous because no pain. You can't pulmonary system. You're talking about chest or respiratory system. No,
Okay.
and see, pulmonary means that it can easily travel from here to your chest region, meaning that the deep thrombosis, right, of your proximal vessels, no, right, can easily progress to pulmonary embolism than the lower extremities, no. It is a ulnar deep thrombosis now affected blood vessels of your thigh now, and no can easily generate progress to pulmonary embolism. That is if the management does not go so well.
Okay.
Generally, no, that is what DVT is.
Wow. Not just DVT, no. Obia tuminya. Ababawa, abrantie, ababunu, menkane tiawa. You know, anyone is all of us are at risk of getting DVT, or it is meant for some particular group of people. Be to say, or
so okay. Anybody can develop deep vein thrombosis.
Okay.
But there are certain things or certain situations that puts you at risk of deep vein thrombosis. And I'm going to mention some of these risk factors or certain things that puts you at risk of deep vein thrombosis.
Okay.
So one of the first one or the most important one is obesity.
Obesity.
Increase in obesity, weight gain.
Okay.
A lot of weight in the so a BMI greater than 30. So BMI 30 and above, right, or above 30 is obesity. And BMI ne was through like it puts you at risk of deep vein thrombosis. Immobility. Immobility, I just say baby for a very long time. Especially those who are bedridden, because you are really been for a very long time, you can easily develop this deep vein thrombosis. So that is immobility. Okay. It's just laziness. The obesity prevents you from even moving so much. So some people are so heavy that you don't even move. This is an sorry, that kind of thing.
Hey.
Those things put you at risk of deep vein thrombosis. Another factor is pregnancy. When you get pregnant, your risk of developing deep vein thrombosis also increases. Those who undergo major surgeries, especially orthopedic surgeries, surgeries of the bone, joints, especially like if you do hip replacements, those major orthopedic surgeries, they all put you at risk of deep vein thrombosis. Okay. Sometimes certain medical conditions like heart failure, stroke, heart failure, myocardial infarction, all those things put you at risk of developing this deep vein thrombosis. A number of things. Also, some people on certain medications like these hormonal therapies, or more hormonal therapy, especially like for there's management for post-menopausal syndrome.
Okay.
So those menopausal syndromes, more estrogen therapy. So for management of menopausal symptoms, more estrogen therapy for sometimes contraceptive use.
Okay.
Some of these medications, like if you don't get the right counseling, can put you at risk of some of these deep vein thrombosis.
Wow.
So hormone therapy,
yes.
Those generally hormone therapy, all those things can put you at risk of deep vein thrombosis. So a bit more, it can happen to anybody, depending upon a number of these risk factors. Very important, smoking. Smoking is also a major risk factor.
Yes,
smoking is a risk factor for a lot, especially in the cardiovascular diseases.
Okay.
Smoking is a major risk factor for most of these cardiovascular diseases. Maybe one of these days we take time to talk about how smoking brings about some of these conditions.
Wow.
But smoking is also another risk factor that puts you at risk of this thing. So, me say when you deep vein thrombosis, me say it's like usually a combination of these risk factors. See, your BBI they assess your risk of developing diabetes.
Okay.
I'm afraid a well score. See, so at the hospital setting, there's well score and they check your risk of developing diabetes. See, you calculate a number of these combinations are what to be a otana se chebebre, will be a oyese, moving, or hormone therapy, so you smoke excessively. So if you combine all of these risk factors, now they are mouse score, then we give you your risk of developing deep vein thrombosis. So if your risk is higher, you do to a draw to prevent you from getting it. If your risk is low, it may not be necessary. Just counsel you. But if your risk is high, you put you on medicines, a kind of prophylactic medicines to prevent it. As I said, that you don't get.
Wow. Maybe and then they mention the for cra. Na anti science by ana better no who say oh yeah deep vein thrombosis ya rabi. Na fe na mo be na obetu.
Yeah. Thank you very much. And see, with the deep vein thrombosis, no, said Amaka, usually it affects the lower extremities, but it can affect almost every blood vessel there. But most of the cases it affects the lower extremities. And so, when you some of these deep vein thrombosis now, when I need to miss swa and I to make hono, when I need to make swelling. Okay. A swelling, sometimes it may get tender. Like I said, tender is a odon start out yaw. It becomes painful. So a swelling, so edema. Now you can watch them. See, a swelling sana. The edema is pitting. Until odon samia a tomb. What I say, usually it affects one leg. You kind say when you say unilateral.
Okay, unilateral.
It doesn't affect both legs.
Okay.
Most of the time, no, the nine back and I affect it. But it doesn't mean that it can affect both legs. Yeah. But most of the cases is unilateral. It affects one leg.
Okay.
So one of the things I want to say, the leg become edematous, and I say eswa. The edema is pitting. It becomes very painful. Baby affecting it becomes very painful. Another thing is that it becomes red. Red in the skin.
Red.
Ayeko, sometimes skin ayeko. Another thing I find differential warmth. Sometimes we don't start to online so I won't say but we say online in a normal temperature.
Yeah.
But we say then I find a differential warmth. Sometimes you can have superficial veins growing over your leg. You want to say veins now what skin it becomes prominent. You see there are normal veins around the skin, but this time it becomes prominent. Okay. But this superficial vein is not varicose. We have varicose veins. Veins in the eye usually their presentation is different from this. Not usually But this one, just the veins around that side, closer to the skin, sometimes become prominent.
Okay.
So this disease can easily be mistaken for other conditions, especially cellulitis. Cellulitis is a disease of the skin. But one of the things that can differentiate is usually the unilateral and then the risk factors. So usually if you have some of these things, as much as possible, just quickly see your healthcare professional, report to the hospital, let's do assessments and make sure that it is not DVT. So if it is not DVT, if it is cellulitis or any other condition, you can easily be managed, you'll be fine. That kind of thing. But just rule out DVT because, as I said already, DVT, the complication of DVT is pulmonary embolism. And pulmonary embolism is life-threatening. It's an emergency, medical emergency. It can easily kill you.
Okay.
So as much as possible, if you notice some of these things, then quickly report to the
nearest hospital.
Manage that kind of thing.
I see. How can we prevent it?
Okay. So,
how can we prevent that? Because it looks scary. Or it sounds scary. You just said it can easily kill you. And when so how can I be able to prevent this from happening?
Okay.
Yeah.
That's it. But generally, my goal here is not to scare anybody or to scare any. Sometimes it won't because I can't wait. Bibi ka crazy like I'm just giving a caution.
Yes.
Like and yet, my goal is not to put fear in anybody, but just for you to just be aware of some of these things. But I know if you notice this thing just go to the hospital, make sure you are feeling fine. Just go and check, make sure that everything is fine.
Okay.
But my goal is not to scare you.
Okay.
So some of the things that can put you at risk of these things, I said I can say the bedridden and see who will be I might say why a surgery and I say be right now. A woman once in a while just gets up a little 90 kakra. But what I say like men daho and I meant na baby back home and chest for so long. So the drivers are more driving call long journey. Me drive free tamale, or drive call honey or drive for a certain distance, especially about 2 hours, 3 hours, but you're parking 90 kakra. What I say, if you are on a long flight, over flight for a long distance, just once in a while get up and walk in the plane, 90 kakra. Don't sit for too long. Don't sit in the flight for too long. This excessive smoking, right? So if you are someone who smokes a lot, reduce or try to cease smoking, reduce alcohol intake and then exercise regularly to help maintain your weight. obesity is a major risk factor.
Okay.
So one way I've been born free some of the DVT and say like maintain an adequate BMI.
Okay.
So the dynamic time, say a BMI should be between 20 to 25. That is optimal. But if it goes a little beyond 25, that's fine. But it shouldn't go beyond 30.
Okay.
So if your BMI is going beyond 30, let's try to bring it back within the optimal ranges. Finally, and don't cross your leg for too long.
Hey, and I'm crossing my own leg.
I mean, like,
so a short while, right?
So don't sit down and cross your leg for a very long period of time.
Okay.
To be very practical, sometimes what's a bit meet now so it check too much. Maybe don't be any the door near day once a or till now for like about 2-3 hours. It's very dangerous. The doses are very practical. Sometimes especially like one part of your body, or that continuously. Once the normal female cry, mother 3-4 hours, not or that one is also very dangerous. Those things can put you at risk of some of these DVTs. So you might call some of these things too.
We shouldn't sit at one place for a long time or for too long until all the time and all the time. So how many hours? And I say, my friend said, I mean, so for how long can you do that? And then I mean, me person clarity on this because we need to know. You're resting.
Yes.
Why you want to lie down and rest your body for some time. So and no person you clarity say how long can you do that? To lie on at one particular place for a long time.
So just to clarify what I said, that is not to say I shouldn't rest. What I'm saying is something that you do continuously.
Okay.
So if you are somebody that you are immobile all the time, for about 6 months or them or movie or the whole baby back near the journey brain, that is where the ginger. But also you can sleep up to 10 hours. It's up to you. But and me can say would die and I'll rest and I'll say you put no. It's like like the businessmen, I don't know. It's always on the flight. No call her, no banner, I don't know.
Okay.
Such person, for long flights, sorry, kakra, nancy. Or if you're a driver, be omuchi buses near 207 buses say who drive kakra, anything I have more rest stops, who drive ya 2-3 hours, like Jina kakra, now also see nancy kakra. Men drive continues from here to Tamale. Men yen debia. If you do that continuously for maybe a month, 1 year, 1 year, 2 years, I don't know. Your risk of diabetes increases. But I mean, can't say it becomes a habit.
A habit.
Now we're sedentary for a very long time. That is where the risk increases.
Wow. Abusia for Safe na wabadwuma de yiswa. My health checks with Dr Bobson Ateko. I want kasamosom for him Lily M. Obet me so afre me. Maame Carlos, me na dwuma de yi. I me di ho chia me. I wo Lily M TV so. Makase. E me bia we ba hwe me bia no. Subscribe page. Na share no ho hia. Papa say asema ye ka no dwuma de yi so yi ade ese obi atibie. Se de be ya obi an so de be bo ono so ne bra efa apomudin ho. Enti me srew ba no wa share. Facebook, all promotion TV, TikTok, they say you made your TikTok, Lily M TV, and IG, Instagram, and so all promotion TV. Na maybe I know you made because ya be a diet the bremo, YouTube so Lily M TV so said they be ya wow shame and me am te hey na ye be ya pomodin so ye my health checks with Dr Bobson Ateko. Doctor, wakasapa mani bia onya DVTB na wanya about say 10-15 years ago na onya DVTB. O kind of madwene ba so say ampa makai say mate say ampa ma me bi nya bi some 10 years ago 11 years ago na enkuno, even though it was severe, but what say enkuno. Now so still the nine no, omwa na hono, omwa na ejai, omwa na hono, omwa na ehhehye no, omwa no so doctor, obeka ho asem sen na die na onye.
Okay. Me trust I think that one of the things I'm to keep hydrated. Let me just touch on that before I go on.
Okay.
Hydration is very, very important in DVT.
Hydration.
Yes. Dehydration, one of the major risk factors leading to the DVTs. No. We will be our own time no right? We encourage you to drink a lot of water because like insulin will help to reduce the viscosity of your blood. So when your blood becomes very viscous, it's one of the risk factors of developing the diabetes. Obisa no.
Okay.
Baswa. One of the things I say encourage the person to keep hydrated all the time. Make sure say it doesn't go into dehydration. And yes, like this, if you're not bed, make sure that it has some fluids.
Okay.
Like make sure that you're always taking fluids, water. If you're not bed, it shouldn't be too dry all the time. Like you should have some fluid, not one. So keeping hydration helps to prevent it. And I can DVT, say so, for a long time. What is happening is that you are blocking the blood flow to certain parts of your body. What I say, and he said when you block blood flow to certain parts of your body for a very long time, some of the tissues and our cells now necrosis. So they become hypoxic, such that a necrosis now say like tissues never. When that happens, there are cells that can regenerate. Most of the cells can, some of them cannot regenerate. But depending upon the kind of damage that the DVT causes, sometimes some of the damage, you can lead to some of these neuropathies near and then some of them will be there for a while. Unfortunately, what I say, So sometimes the person after DVT, especially prolonged, if it wasn't managed well effectively, I won't say like over time, you can develop neuropathies because like if blood flow to some of the nerves, the nerves there also begin to die. They're also cells.
Okay.
They also begin to die. So if the nerves do not regenerate on time, and I say if you are not on therapies to help nerve regeneration now, sometimes like you may experience some of these neuropathic symptoms for a long time. And then sometimes DVT, so if it lasts for a long time, so it may lead to complications the lower feet. Until blood flow is not reaching there, meaning that honey to me started say pro kakra neuropathies now you can't have them. Sometimes you find it very difficult moving your leg because the nerves there are all getting damaged and that's why I'm saying that if you are at risk of the DVT now, as quickly as possible, like you act on it. So if the risk factors are modifiable, some risk factors are modifiable, some risk factors are non-modifiable. The modifiable risk factors, like the smoking, the obesity, your diet habit and all those things, those are modifiable. You can easily modify them. Some people it's not very modifiable. But or certain diseases are a bit may affect you. Blood clotting disorders that makes your blood clots rapidly.
Okay.
Like hemophilia. Hemophilia or sickle cell anemia. So your blood easily clots. So for such people, that risk factor is not modifiable. Won't to me personally, and to me, share and just that it puts you on some medications. Those are not modifiable. But those with the modifiable risk factors, we encourage you to, as much as possible, try to do something about those risk factors. But unfortunately, it can lead to some of these neuropathies that can be there for a long time.
So, in this, situation, I know that we can't do or make prescriptions on this program, but then we can make some recommendations like some vitamins and she is in this situation for the past 10, 11 years, so what are some of the vitamins that she should be and the food and whatever that she should be taking just to keep herself,
so essentially the B vitamins are really good for nerve regeneration. So like the B1, B6, B12. These B vitamins are really important or help with the nerve regeneration. So as much as possible, you can be on some of these B vitamins. Those are supplements that you can easily get without a prescription. So some of these B vitamins can be on them. As much as possible, watch your diet very well so that always your blood is flowing very well. So eat more greeneries, the green leafy vegetables, fruits and vegetables. So that you always get the adequate nutrients to ensure that your blood is like working as it's supposed to be. So there's always supposed to be a balance between the coagulation and the anticoagulation arm of your blood. Your blood shouldn't clot too much, and then it shouldn't be too thin.
Okay.
There's supposed to be a balance between these two. And then the proteins near there, some of them we get them through our diet.
Okay.
So if your diet is not so good to maintain this balance now, a bit more hard. So such a person, you have to eat very well, make sure that you're on some of these balance. These B vitamins also help with the nerve regeneration. And sometimes for the pain too, there are some pain medications that helps with neuropathic pains, like the pregabalins and then the gabapentins. They help with this nerve. So if you have a problem, if you have some of these neuropathies, if you are not sure about it, just report to your healthcare professional. They help. If you diagnosis of a neuropathy due to the DVT, you just put you on some of these high dose B vitamins and the pregabalins or the gabapentins to help manage the pain. And then sometimes you see some specialists too, they may have some advanced interventions that they can do to assist you.
Wow, doctor, and then they may say, me too much. Now, membu some final enough yamfa adwumadi ni ma ka kan adwumadi na ba wie yampo ni sa na yaka enioma enura se onum vitamins, you know, I say fa na nnuane ese odi no na nnuane bi won so a ense say because e bia na 10 years 11 years ye na nnuane bi wo a ense say onia no odi not only that particular woman but there are other people who have also been there who has the same issue or challenge, and then they are still eating basa basa. Then small time there's an issue with them and all that. So, and you maybe what answer say we a go be one say on when I said duane bi one say udi a beboa a udi ya no ntina ma udi a udi wi tino entimi enfri so da.
So thank you very much. So another thing I was say I can say sometimes no, if you are on DVT, you do two certain so blood thinness.
Okay.
In drona, so sometimes you can be on this blood thinness for a couple of months, like sometimes 6 months, 8 months, for a long time. So these blood thinness, no, they make your blood thin already. It is so and also have that kind of those properties now.
Okay.
It can further thin your blood and put you at risk of bleeding. So ideally, when you have some of these medications, your healthcare professional is supposed to advise you on some of these foods that are supposed to take. Some of them include this ginger, garlic, do you understand? Ginger, garlic, do you understand? And then the cloves and these things. No? These foods, no, blood, like they are good. I mean, like it's important to help ensure adequate blood flow.
Okay.
But if you are on some of these medicines, the blood thinness, no, a drug that is already thinning your blood, and you take some of these foods now, it will to me put you at risk of bleeding. Do you understand? Because your blood will
bleeding no fi hen no.
So you can bleed through your mouth, your nose, your gum, and I say upra, you bleed excessively more than usual. And all your bars who are doing your period, so you can bleed more than usual when you're on some of these foods. So if you're on DVT, or you're diagnosed of DVT, now would that a drug this ask your healthcare professional saying pacho ejani ben and amamindi so that so depending upon the type of blood thinner there are some plants because some of these plants have these blood thinning properties so that you protect yourself from it. But generally, like some of these, Mr. Emeka said the etiology of some of these things, some of them is atherosclerosis. So your diet is very important. So especially when you're advancing in age, reduce your cholesterol intake. So reduce the carbohydrates, cut down on your carbs. Reduce eating of red meat. So as much as you can eat dry meat, fish. The fish oils are very good, omega 6, 3, and 9. If you take some these sardines, fish, dry fishes and all, so not that men do meat cry, like just cut down a little. Because some people they're man in so if you go and tell someone not to eat meat at all, and the person becomes so depressed that he doesn't even enjoy life anymore. But like
you can take it in moderation.
The point is to do things in moderation.
Is contomere good for a DVT patient?
Contomere is good. Contomere contains a lot of ions, increase blood flow, improve blood thinning properties. But as I said already, contomere for itself is not among of the foods now. From what I've read, it's not among the food that can really affect the blood thinning activity of some of these drugs. So you can take your contomere with it helps, especially if you are not on any medicine for the DVT per se. Sometimes after the treatment, post after you are done with everything, some of the foods I can eat include the contomere. It can really be helpful.
Wow, now you say idea na say a year kakra garlic, ginger,
yeah, cloves.
Sa anyoma no and na say wo draw Emma blood no.
You have to be careful of some of those foods.
So
especially when they're taking them
harmful.
no, it's not harmful. When they're taking them in high quantity.
Okay.
You have to be very careful.
Okay.
Or report to your healthcare professional before you continue taking some of those things.
Oh, okay. Oh, bushafo dwumadie no a na wi ya na de ba no ne so mi ankasa mo so for him Lily M masua de papa masua de menim sa won so a wo hwe me ne won so wasua de fa bibi a won so wo de bebo bra na yade ama maye wo so asem and my health checks with Dr Bobson Ateko e de aba na wi ye doctor e de be asem na be kan tiawa simampo enu.
Okay.
Now there are two one year efofa or mapomoden ho.
Okay. So that Make, we say almost every segment we are making about these healthy lifestyles. No? It's very, very important. Just protect yourself from some of all of these conditions. No? Let's try as much as possible to maintain a very healthy lifestyle. It's my passion to ensure that the public health of the people of Ghana is really good. As part of that, my passion, I may hear some of this you may do, so that ensure health promotion. And he said, as much as possible, try to maintain a very healthy lifestyle. Not to say don't have fun. Do you understand? Have your fun, but always have at the back of your mind, say you do things in moderation. Or yeah, just my dream around and say, I need to maintain a healthy lifestyle so that I don't really get myself in any kind of situation. Do you understand? The American and then especially the youth now, like let's be careful. Don't feel that you are invincible, because like if you can, any of us, any young person can end up in those kind of situations. So let's all be very careful. Thank you very much.
Wow. All too soon. We've come to the end of this segment. Dr. Bobson Ateko on My Health Checks with Lily M, your host. Mesu Shema Butmaswa from Vien Maame Dr. Akasa. Yenya nyoma in moderation. Maya adwenye say ya bebu nti ebetima ye ni pebia shisha no yesi ye nyai cigarette no yesi ye nyai ensa no yesi ye nteso ye no ne kakra bi ya nhwe ye hoso yi a ye betimi akofa ya de a ebema ohaw aba ye so medama se da sene ye besa na ehia